Hello, my name is Robin Desrocher. I am a manager in the Risk Management Department at TMLT. The patient experience starts before the patient walks into your office. How they are treated by you and your staff, along with the patient's perception of that experience, sets the tone. Here are 5 tips to minimize patient frustration in your office. Tip 1. Facilitate the check-in process. The completion of insurance forms and health history paperwork takes some time. It may take some patients longer than others. When patients schedule appointments, ask them to go online and complete the necessary paperwork prior to their appointments. If that's not an option, ask patients to arrive 15 minutes prior to their appointment. This might avoid some check-in delays. It's also a good idea to have your staff explain the rationale for why that paperwork is necessary. They could say something like, "The insurance forms will help us properly bill for your visit," or "The health history forms will enable your providers to have the most up-to-date information on file for you." Patients may be more understanding and cooperative if they know why that information is being requested. Tip number 2, use helpful signage in your reception area. Consider posting a sign. It could state, "Please notify the receptionist if you've been waiting a certain amount of time. We will check on your appointment status for you." This will keep the lines of communication open, and it could identify a check-in process error. Tip number 3, please give your patients a heads up if there will be a long wait. There are many valid reasons for patient delays. Keeping your patients informed is a good way of building a positive encounter before the patient even gets to the exam room. If you find yourself falling behind, ask a staff member to go out to the waiting room and greet your patients who are waiting to be seen by you. They can apologize for the delay, and they should consider updating the patients regularly so they're not waiting without any information. And also, don't forget about those patients in the exam rooms. You'll want to make sure those patients receive updates as well. Tip number 4. Leave your frustrations at the door. Although you may be frustrated about being behind schedule, it's important to start the visit off in a positive way. Apologize to the patient for the delay. Although they've heard that from your staff member, it's not the same as it coming directly from you. Tip number 5. Interact with your patient, not just the computer. Make eye contact with your patient when you're entering data into the EHR. Explain what you're doing so they'll understand if there's a few moments of silence. If there's something valuable for the patient to see on the computer screen, like vital sign graphs, images, test result comparisons, don't be shy, show them. They'll appreciate the involvement in the visit. All of these tips go a long way to minimize patient frustration in your office. Thank you for your attention. For more information on risk management services at TMLT, please visit our website.